Hi there, and welcome to another episode of Women with Good Chat. I'm here with my good buddy Pam.
Good morning.
How are you?
We're going to talk about that, I think. We haven't rehearsed anything. You said I'm supposed to take your lead. I'm
As
just
always,
taking your lead.
like
Okay,
to
I am taking your
shoot from
lead.
the hip.
Yes, absolutely.
So today we're going to talk a little bit again about self-care, but more about health and your own health and welfare, and how it's so important, as often women are the caregivers in the family. We forget to look after ourselves a lot of the time. And Pam just told me that she has an injury on her knee. She's going to tell us a bit more about that, and how she is often lax about looking after herself. She does a ton of hiking, a lot of walking vacations, brutalizes her body a little bit. And she's well versed in this because you also had operation on your knee.
I did. I had an operation on my
Tell us about it.
Yeah. Well, my left knee, I had some surgery on about 7 years ago. I think I've done the same thing to my right knee. Now, we've talked a little bit about the fact I have some arthritis. And I think I've been, as we're talking about self-care, a bit late to come to the table with what I need to do about controlling that. And to be more specific, something I have done is that when I'm going to do a trip, or I know I'm going to do some quite extensive hiking or something, I will take a drug called naproxen, which helps with the anti-inflammatory, helps get me through it. But this time I think it's backfired, because I think it actually allowed me to do way more than I should have been doing with my knee. Didn't feel the pain, weren't getting the signals, and then once I came off the drug after kind of the 3 or 4 weeks I was using it to get through a trip, now it's backfired. So I think it's a really important lesson of that, masking the symptoms means you're doing more than you should be doing.
Exactly. And as always, especially at our age and going forward, when something goes wrong, you want to make sure that you are getting in touch with your healthcare professional, and that you are looking after yourself right away. One of the interesting offshoots of this whole episode is that your partner, Greg, is real. Oops, sorry. Can I say Greg?
Greg, absolutely. Absolutely.
That he's really stepped up. Not that he hasn't before, but tell us about that.
He is really there's been 2 offshoots. First of all, Greg stepped up, which is great. Not a surprising offshoot, but a really positive one. The bigger one for me that's a surprise is I am a terrible patient. And for so many years, as I don't know if we've talked about, I did a lot of caregiving for elderly people with disabilities. I couldn't understand why people found it so hard to take help from other people. I was very much like, we all, everybody needs help at times, from a philosophical point of view. To me, needing help is nothing to be ashamed of. We all need it. We all go through periods of that. But I guess, in retrospect, been extremely lucky about the limited number of physical, limitations I've had. Because I am a terrible patient. I am just terrible. My husband, he's so frustrated with me. I'm supposed to be resting this knee. Next thing you know, I'm wandering downstairs doing laundry. I'm doing this. I don't want to wait for 15 minutes to let the dog out. I'm not a good patient. And, I was saying, I do a regular shift at a food bank on Wednesdays. And the amount of debate that went on in my head about canceling that shift, right? We are short food banks, I think we all know right now about the food cry. We can talk about that sometime. It's an issue very close to my heart. But it is really freaking obvious I should not be doing the food bank shift, right? But for me to make that call was agonizing. And so that's, it's that separation between, yes, I talk about self-care. Yes, I preach all this about, if you want to do the things you want to do, go and take care of yourself. I get a knee injury, and what am I doing? I'm just talking out of both sides of my mouth. So,
well, it's also very difficult when you're used to doing your own stuff, and delegating is not easy. It's very difficult to not want to get up and do things, whether it's a fun thing or just a usual routine thing that you're used to doing around the house or at the food bank or for your kids or whatever it is. It's very difficult to just stop doing that, even if it's for a short while.
Yes, absolutely.
But
we have to do it. I mean, we really do have to do it. And I think part of graceful aging is understanding, not necessarily, I say not accepting our limitations, trying to keep ourselves doing as well as we can so we have as few limitations as we can, but accepting those limitations, because it's very difficult on the people around you. And to be honest, somebody responsible if you don't. Because if I keep doing what I'm doing and blow this knee entirely, right, I am going to be of very limited use to anybody, particularly myself. I have a very big trip planned in October, and I got to get on that trip, and I got to get on that trip in good shape. So, got to do a better job of being reasonable.
No, exactly. And it brings to mind something that is near and dear to my heart, and that is building and maintaining and building muscle. And I know you're on an exercise program right now for arthritis, and that you're finding very, very helpful.
Yes.
But I think one misconception with women is that if you lift weights, especially heavier weights, that you're going to build bulk. I can guarantee you that you're not going to bulk up unless you're on steroids.
Yeah.
Man or woman, really.
Right, no.
But especially for women. But building muscle and having more muscle than fat, if you can get to that, that's not always the goal. But obviously you want to have a healthy physique, and a healthy physique has a lot more muscle.
Right.
And not that your knee injury wouldn't have happened without more muscle.
No, but
it helps protect everything, including your skeleton. Right?
Absolutely. And I think, really particularly as we age, and I'm going to go into a bit of controversial territory here, but as we age, that amount of muscle really needs to get maintained and get built, right? I mean, I think we're already getting to the point, if we're in our mid-60s, where all of that is getting harder.
I'm not in my
You're not in
mid-60s.
your mid-60s. Okay, harder and harder to build. And if we wait to later in our 60s, it's going to be really hard to build. So we need to start doing that now. And you're right. I mean, I think as women, we've often way over cardioed, right? Way over, all of us maybe did as a society, way over cardioed. And if we can't do everything, you're right. It's the emphasis on the building, maintaining of the muscle, which we should be doing. And
and you want to be mobile. I used to run. It's always hurt my back. I don't believe in running. I used to be a Stairmaster fanatic. I did step classes, like in a throwback machine in the 90s. But you can get your heart rate up, jacked right up if you lift weights.
Absolutely.
And, again, if you can do something 20, 30 minutes a day, a combination of things, but always trying to add in a bit of weight training. And it's a couple of dumbbells at home. You don't have to go to the gym. Anyway, but it's all about kind of protecting your body, protecting your skeleton, ensuring you're strong and healthy. And when you're not, there's another delivery. When you're not feeling 100%.
Running a home business. This is what it's like.
That you go to your doctor.
Yes. And you be reasonable. Okay. You be reasonable. And for me, that's ending up to be way more of a challenge. I mean, if you would have told me this, I would have gone, no way, that's not me. I'm going to listen. I'm going to do it. Here I am in the middle of it, and I'm not. So this is big. And, my partner has stepped up in an amazing, my God, he made cream of asparagus soup last night because I had the stuff in the fridge and I'm like, it can't go bad. Do the soup. And you know what? He did it. But how long it took me to just say, you know what, first of all, if the asparagus went bad, it should have. There's an issue. But, he's been great, but I haven't been. I haven't been great about it. So live and learn.
Well, exactly. And often when we talk through these situations and our experiences, we really do learn from them. And when you go through things with your partner, other family members, close friends, you are all learning. And again, aging, if you have a partner and you're aging together, it is good to go through these things because it's a good learning experience. And again, it teaches you how to cope with something. We were talking about dealing with grief, losing parents, etc.
Yes.
A couple episodes ago, and just how that can affect couples, and we know someone who managed it incredibly well.
Yes.
And I think those things strengthen that bond when you go through things. So again, when you have a partner helping you out in these situations, it's really rewarding.
It's very rewarding, and it's really important, I think, to communicate that you're appreciating it. It's also one of those things, you're not feeling well, right? You've got your limitations, you're struggling with the fear that goes along with that. And it's very easy not to acknowledge what they are doing. Okay, that's an easy thing to do. So for me, it's very, very important that, and I hope I'm doing this, you can ask him while I'm doing this. I hope I am being gracious with that too. I hope I am internalizing the fact and finding comfort in the fact that I've got a partner who is stepping up. Right? So kudos to him, and let's hope I am letting him know that on the basis.
Let's hope that you actually do follow up and get to see your doctor.
Yes,
I think you potentially are going tomorrow.
Read the Riot Act here on missing an appointment. But yes, you're absolutely right.
Gave Pam a bit of a hard time.
And on that note, brings us back to why also we need our girlfriends around right now, right? Because they are also the ones who are going to help you with this, right? They're going to be there to say, should have taken the appointment, how are you doing, and all of those sorts of things. So to get back to the bigger the circle, even if it's not with the everyday help, I've got that with my husband, but in terms of people to kind of keep you on, should you be, if I would have told you I went to my food bank shift next week, somebody should be there saying, you know what, that was, got to think about that. That wasn't right. Gently, but we need to help each other keep these things in perspective.
Tell your friends the good stuff and tell them the bad stuff too.
Tell them it all.
Well, this was awesome. Thanks so much for sharing your experience, Pam. And we look forward to seeing you on our next episode of Women with Good Chat.
Take care.